Hello, this is Dr. Do again. This video is on alphabetic list of problems, still on letter I. Today I'm going to talk about a condition, it's called intussusception, which is referring as a medical term, actually. It's two segments of the intestine, either colon or small intestine, usually it's larger intestine. Inside one segment of the colon, inside of the other segment. So this is called intussusception. Usually it occurs either in elderly or in young children or in those people with pre-existing of digestive system disease or colon disease. First of all, let me just talk about the emergency situation. Is there any emergency situation associated with this intussusception? Yes, usually the presentation is like a bloating, pain, and sometimes may have the jelly-like bloody brown mucus diarrhea, or sometimes just feel without gas passing. And if it has been going on for a while, particularly for those elderly or young children, for elderly has other conditions or bedriding, and this kind of condition could happen if you notice that this kind of severe abdominal pain because that or lost the bowel sound. So that's really kind of serious. Probably the intussusception really for a long time or severe cut of the blood supply. So that's the emergency. It could be life-threatening. It could be minor, actually. Sometimes can release, but like I said, if this is the situation, like the pain or nausea, vomiting, or the jelly-like diarrhea, mucus for a long time, and a patient's condition getting worse, no improvement, either for children or for elderly, go to the emergency. The sooner the better. Sometimes, if luckily, actually, especially for young children, if during the rise of the car, and this because the bowel keep peristalsis keep moving, so sometimes can push it out by itself. So, but regardless, if it's the abdominal pain and getting worse, nausea, vomiting, and especially for older people, actually, it's more serious compared to the young children. But for both groups, regardless if this what happened, no gas or passing those jelly-like diarrhea, severe abdominal pain, nausea, vomiting, or may or may not have fever or altered mental status, go to the emergency without hesitation. So this is about the emergency situation. Can you manage at home? Unless you're trained medical professionals, you know it. You, for example, I have, or somebody else, a physician had a kid, feel cramping pain, abdominal pain, just restless, but the physician examined and knowing what's going on, can monitor or observe or use some minor treatment, but probably you cannot manage home. You have to go to the physician, talk to your physician, even though it's not emergency, but you still need to manage, call your physician to confirm and to go to test. And sometimes during this X-ray exam, because inject something and then just open it up. So having talked about this, let me just explain the intussusception. What is intussusception? It's, like I said, one segment of intestine stuck in the other side. So that usually because the peristalsis of the intestines going segmental, like one segment and then next segment. So for those people, for young children, when the neural ganglion not fully developed, or for those has a pre-existing digestive system disease, particularly like those neural ganglion are not perfectly developed, or for the older people, or for the pre-existing condition like the cancer or ulcer, or some kind of disease, or the older people with degenerative change with the food or less of vegetables, etc. So if that's the case, then the segmental of the intestine without relaxed, and then the other segment coming and then just stuck in. And for healthy people, young healthy people, it probably happened, but sometimes with the motion, keep moving, can release it. But like I said, if the symptoms getting really severe, which means it's not released, you have to see the physician. What are the signs or the symptoms? You feel cramping, abdominal pain, persistent actually, and on top of the persistent with intermediate worsening. So that's kind of the sign, and may have nausea, vomiting, may or may not have fever, and sometimes may passing the diarrhea or gas, just the minimum of gas or diarrhea with jelly, brownish like, because just mucus mixed with blood, or without gas passing. So that means really completely blocked the segment of that colon or intestine. So if that's the case, have to call your physician and rush to the emergency room or to discuss. I do not recommend you to do anything. Some people actually, it could happen if you use a little warm water, a minimum amount, because if that's, I probably should not say it. Again, this video is just for education, not take responsibilities for any medical advice. If you use a minimum amount of warm water, sometimes may release it, relax that segment of the intestine and open it up. But I do not recommend anybody do it at home. No, please don't do it. Call your physician, because if the ischemic occurred or the necrosis of the intestine need to be surgery, surgical management always fasting or limited oral intake without taking anything, that's the best. So do not do it at home. But I'm just saying the mechanism could be minor, could be just stuck each other for just overlay very little bit and then you open it up, but do not do it at home. If you have this kind of symptom, particularly actually quite often in young children less than 2 years old, do not do anything, just rush to the emergency room. If you see the diaper has this kind of brownish mucus, jelly-like diarrhea, just go to the emergency room to hand it to your physician. They will handle it safely and in time fashion. So this is about this kind of introductory for this intussusception. It's quite common in children and in older people. So I'm going to stop here and hope that will give you a little idea or information on this disease. And you can, if you're interested, you can search more. Thank you for watching. I will see you next time.